What is diabetes mellitus?
It's a metabolic disorder.
Characterized by hyperglycemia.
Diabetes affects approximately 15.7 million people in the United States.
There are 3 basic types of diabetes: type 1, type 2, and gestational diabetes.
In type 1 diabetes, the body does not produce any insulin. In type 2 diabetes, the body does not produce enough insulin. And in gestational diabetes, it's caused by pregnancy.
Type 1 diabetes affects 5 to 10% of all diabetics, and they are insulin dependent.
90 to 95% of all diabetics are type 2. This occurs due to obesity, high-fat, low-fiber diets, and sedentary lifestyles.
Gestational diabetes occurs in approximately 2 to 5% of pregnant women. This condition is characterized by glucose intolerance and has initial onset during pregnancy. It usually disappears after pregnancy. However, in many instances, it will return years later.
Insulin is produced by the beta cells of the pancreas. Type 1 diabetics are dependent on insulin for survival because their pancreas does not produce the insulin.
Type 2 diabetes results from the body's inability to make a sufficient amount of insulin or to properly use the insulin that is produced. This type of diabetes often begins with the pancreas's inability to produce a sufficient amount of insulin as the need for insulin increases.
The demographics for diabetes are 11% of all men 20 years and older have diabetes, 10.8% of all women 20 years and older have diabetes, 7.1% of all non-Hispanic people have diabetes who are 20 years and older, 8.4% of Asians 20 years and older have diabetes, 12.6% of non-Hispanic blacks have diabetes, and 11.8% of Hispanics have diabetes.
Essentially, there are 3 medical emergencies from which a diabetic patient may suffer in the dental office: severe hyperglycemia or diabetic ketoacidosis, known as DKA, hyperglycemic hyperosmolar non-ketotic syndrome or coma, and hypoglycemia.
Signs and symptoms of DKA, aka severe hyperglycemia, are tachypnea, alteration in the mental status, dehydration, poor skin turgor, warm, dry skin and mucous membrane, increased thirst, muscle tenderness, increased thirst, muscle weakness, severe fatigue, nausea, vomiting, blurred vision, fruity odor on breath, hypotension, and tachycardia.
A severe emergency that can occur in diabetic patients is HHNKS. It's hyperglycemic non-ketotic syndrome. In this condition, patients will be hyperglycemic and dehydrated. However, they will not be acidotic. This usually occurs in infirmed, neglected, institutionalized, and mentally challenged diabetic patients who cannot recognize their thirst or express their need for water. Therefore, it's uncommon but not impossible for this condition to be seen in a dental office.
Patients with hypoglycemia have blood sugar levels lower than 40 to 50 milligrams per deciliter. This patient is experiencing severe DKA. DKA can occur in any diabetic patient who is not taking their insulin, not eating correctly, or a patient who does not know they have diabetes. This next patient is unaware that they have diabetes.
Are you okay?
I'm having trouble breathing.
Let me sit you up. You're looking kind of pale. Let me check your blood pressure and pulse. Are you feeling okay? You seem a little dehydrated.
I am a little thirsty.
Let me take your blood pressure. Some respiration. I'm really hot. How are you feeling? Okay.
My vision's a little blurry.
And your breath is fruity.
Based on this patient's signs and symptoms, they need to use a glucometer to check their glucose levels.
Your blood pressure is really low. Somebody needs to call 911. Can you get the oxygen? And can you get the glucometer?
So Sandy, what happened with your patient?
This patient is a type 1 diabetic. She's unaware of it. Her blood glucose levels were elevated, so she needs insulin.
This next patient is experiencing severe hypoglycemia.
Diabetic?
Yes,
Okay. Did you take your medication today?
I did.
And did you eat?
Yes,
And how about your blood sugar levels? Did you check those?
I did. They were normal.
Okay, good. Then I think we can get started.
Okay.
This is an example of confusion.
What is that?
You need to have some sugar.
No, I don't want it.
Hypoglycemia.
Where am I?
You're having a reaction.
Who are
Low blood
you?
sugar.
Stop it.
You need to eat this.
Leave me alone.
This is an example of a coma.
Are you okay? Are you okay? Somebody call 911.
This is an example of syncope.
Oh my goodness, I think she fainted. Let me bring you back.
This is an example of profuse perspiration and cold, clammy skin.
Sweating. You're sweating. You're perspiring. Are you okay?
This hypoglycemic patient would benefit from 20 grams of sugar.